It's been 76 days since the U.S. administered that first vaccine for COVID-19. Since then, about 22 million people have been fully vaccinated. And now a third vaccine has been authorized for emergency use by the FDA, providing a major increase in supply.
Yeah, this one only needs one dose, not two. We know you have a lot of questions about it, and we're going to try and answer them for you. Kathy Park has more.
A new weapon in the fight against a coronavirus, getting FDA authorization for emergency use. After an advisory panel gave a unanimous recommendation, this now paves a way for roughly 4 million doses to be shipped out as early as Monday. 20 million by the end of March.
There will be another major manufacturer, another major vaccine supplier to increase vaccine supply, which would result in a more rapid acceleration of the vaccine effort.
J&J's vaccine requires one shot, is roughly 70% effective at preventing illness, and offers strong protections against variants. The efficacy for Moderna and Pfizer's two-dose vaccine is around 95%. Health experts say all three vaccines work.
We in public health are not at all concerned about the differences in effectiveness of these various vaccines.
But even with another vaccine option, a warning from the CDC about declining infections and hospitalizations.
The latest data suggests that these declines may be stalling, potentially leveling off at still a very high number.
Dr. Anthony Fauci stressing the urgency of getting vaccinated.
The longer one waits not getting vaccinated, the better chance the virus has to get a variant or a mutation.
But with high demand across the country, availability has been limited. This week in Dallas, thousands are playing catch up after delayed appointments due to winter weather.
It seemed like everybody in the world came at the same time.
But promising news in California, where they're releasing more doses to teachers and school employees.
If I'm going back in, I want to make sure I'm vaccinated.
And hopefully shorter lines very soon. Meanwhile, here at home, more hopeful news. The number of cases, hospitalizations and deaths, it all continues to drop. Just yesterday, there were 897 new confirmed cases and 27 more deaths. Vaccinations are increasing, with 981,000 people having gotten their first dose. More than 500,000 Hoosiers are now fully vaccinated.
And as these cases drop, everyone is hoping to get back to normal. But part of that process includes getting children vaccinated and back into the classroom. A pediatric infectious disease doctor at Riley Hospital says that clinical trials on the effectiveness and safety on kids is going on right now.
We hope to have information about that sometime this summer, hopefully by the middle of the year, so that we can really look at the data. Again, we really want to be driven by the data and driven by what we're seeing in clinical trials and well-designed studies.
Well, Pfizer and Moderna are conducting those trials now. Johnson & Johnson is yet to announce any pediatric studies. But if those trials are successful, kids as young as first grade could get vaccinated by September.
It's now up to the Senate to debate the $1.9 trillion COVID-19 relief package. It passed the House earlier this weekend. It includes $1,400 direct payments to many Americans, a $400 a week federal unemployment bonus, a per-child allowance of up to $3,600, and billions to distribute vaccines. House Republicans all voted against the measure, including Indiana's 7 Republicans. They've said the bill is too expensive and lacks